Okay, well, hello again, and this is Mike Duggan again, and we are continuing the series of videos on the American healthcare system. We have looked at a variety of things in the first couple of introductory videos, specifically having to do with personal qualities of all the people that are involved in the healthcare system, and how important that is to whether you get good care or not, how important that is to determining whether you get the choice or the ability to get good health care. So anyway, we'll talk more about those personal qualities later on. We have talked in video 3 about the wellness community, all the people that are intimately and directly involved with your health care, with providing you health care. In video number 4, we talked about the legal community that creates a sense of liability for the healthcare providers. And so that involves lawyers, courts, and lawmakers. And now we're going to talk about the healthcare industry. This is a pretty big group of companies. These are all directly profiting from your needs for healthcare. So many different organizations, many different companies, many different industries have sprung up around the healthcare needs of people. So let's sort of identify what some of these are in sort of typical categories. So for example, corporate managed networks. So in dentistry, I'm particularly familiar with this. So you might have a company that is founded to help dentists manage their offices. And this company might manage 1,000 or 2,000 different dental offices. They don't own the offices, but they contract with the owner dentist to manage the office. That's providing human resources, purchasing power, leasing negotiations, setting policy for how the office is run, laboratories, things like this. So there's a lot that is involved in these kinds of large managed networks. The trick with them is that they basically have to appease 3 gods. And we'll talk in a minute about investors, but these networks, these large management companies oftentimes have investors, and they have to answer to the investors. They also have to answer to the providers. Do they give the provider basically a venue where they can feel like they are utilized well and are really accomplishing something great for their patients and doing good dentistry, doing good work. And of course they should hopefully make the experience for the patient come out really great as well. So some of these networks are extremely good at balancing that, and some of them aren't quite so good. Anyway, that's a huge kind of industry that's growing a lot within the dental field. And there are similar things like that within managed medicine at the same time. I just don't know much about that. And then, as I said a moment ago, investors. So when you have a large hospital chain or you have a managed network like that, it's capitalized by either rich people that are investing in it, hedge funds, venture capitalists. They might do an IPO on the stock market and get money that way. But the companies that are using investors, and it could be any healthcare company, they're answerable to the investors. They're answerable to the investors. And so that can compromise, or it can potentially improve the delivery of healthcare. We just don't know. It depends on the corporate dialectic, as it were. Okay, so investors are an important part of the equation as well. Hospital chains. About 80% of the hospitals are nonprofit, but there are 20% that are profit-making. And they make, last thing I heard, about 8% profit margin every year, which is pretty good. Those are big businesses, and there might be a chain of dozens and dozens of hospitals all within one network, all owned by the same organization, all basically answerable to investors, all publicly traded, for example. Now, when we're talking about hospitals, these years, boy, you don't have to go very far just turn on any station on your TV and you'll see some really wonderful things. When it comes to providers working in hospitals, the hospital staff these days with COVID, they're way beyond admirable. They're just remarkable what they are going through, what they do personally to put out there for everybody's welfare. So my hat's off. If I had a hat on, I would take it off. And of course, the staff is part of the wellness community. They aren't part of the healthcare industry. They work for the healthcare industry. But again, remarkable people. One of the interesting things about hospitals is that they persistently overbill. I've been reading a little bit about this recently, and they overbill. Now Medicare, Medicaid, and so forth don't pay a very large portion of what they actually bill, but insurance companies do. That's interesting. So I'll tell you what I learned a little bit about that in a few minutes because it's interesting. But let's move on to the next category of companies in the healthcare industry: nursing homes, assisted living homes, board and care homes. They all provide services that it would be great if families did. In some societies, that's what families do. In our society, not so much. But picture somebody spending $4,000 a month to live in a home with 6 strangers and sit around watching the TV all the time and just basically waiting to die. That kind of situation doesn't sound like a good thing to me. My grandmother on my father's side spent her last couple years in a nursing home, and the last time I saw her, she was sitting in a wheelchair and just sort of hanging out, just not really taking in much of what was around her. And who knows why that is, but anyway, that's certainly not the way I remembered her. And there's this thing called aging in place. It would be nice if more people did that. Basically, die at home. And there are facilities set up. There are methods set up where that can happen, and I'll tell you a little bit more about that. Anyway, my other grandmother on my mother's side, she and her husband my grandfather were quite wealthy. And boy, they found a great place to go. I mean, it was a retirement home that then became an assisted living home, depending upon your needs. And it became a nursing home. They had their own hospital on the grounds, and it was a really, really beautiful old mansion from way back when. But it was hugely expensive. I mean, only the very rich can go there. They were quite wealthy. I remember this was in the 70s. They paid $125,000 for their condo on the property, and they're paying $25,000 a year as fees. And the condo, there was no equity. So when they died, that just reverted to the ownership of the facility. So anyway, but a great place for them to go. But only the really rich can think about that. So my situation with my parents was my dad was living with me when he died. My mom was living with me when she died, and that was wonderful. And I had nurses coming in. I had people coming in to take care of each of them, various times during the day, and a lot of that gets paid for by the healthcare system. And so, that's certainly possible to do. And we can all hope that when the time comes that we have the chance to be taken care of with some respect and some dignity. Anyway, home hospice, that's certainly a big thing. And the healthcare providers that are the nurses that are going around visiting the homes and so forth, my hat's off to them too. There were several. One in particular with my mother was just remarkable, and there's no shortage of people like that. Another part of the healthcare industry is the stock market. These big, huge organizations are oftentimes publicly traded, and whatever drives the stock market down drives the value of the company down and impacts your ability to get health care. It may change prices, it may change availability, but it's going to have an impact potentially. So that's something worth thinking about. I mentioned insurance companies before. I've mentioned them a couple different times, but insurance companies profit from statistics. They are huge, but they make a lot of money in premiums, obviously, and they're just hoping that they don't have to pay out any more than they take in premiums. They're pretty good at statistics, so they don't have to worry about that too much. But on the other hand, it's interesting that they pay hospitals more than what this is something I read. I don't know this personally myself, but I just read this today, and it's in a book that's been written and published. Whether that's true or not, I don't know. I'm just going to put this out there. This guy was saying that the hospitals pay a larger percentage of what the insurance companies pay for their patients that have the insurance, pay more than the hospital normally expects to get from their overbilling. They might pay as much as half of it, whereas Medicare might only pay them a quarter of it. But the insurance companies seem to be willing to pay more because that gives them an excuse to raise their premiums. And that's where they make the most money. So I thought that was kind of interesting. And again, whether it's true or not, I don't know, but it kind of makes sense. And apparently the hospitals and the insurance companies, these huge insurance companies, they are both helping each other out. Okay, well, that doesn't do you much good. So, we might want to be a little bit more aware about that. Okay, but of course insurance companies also carry malpractice insurance to guard the providers, to make sure they're protected from any perception that they've done something carelessly. And of course they're linked to the government in many respects. Just think about the Affordable Care Act, Obamacare, and so forth. And the goal of the government to provide more coverage, more healthcare coverage to people. And again, that's linked through the insurance companies in a way, but it's, again, pretty complicated, isn't it? I think a lot of you have been aware of that. But a lot more people are being covered now than ever were before. Okay, another part of the healthcare industry is equipment manufacturers. They make machines and devices and products, and some of them are used for diagnosis, some of them are used for curing. It could be a heart stent for a coronary artery after a heart attack. Could be joint replacements. I mean, can you imagine how many joint replacements? I think they're like 4.7 million hip replacements in the United States for as many people as we have. That's a huge percentage compared to a lot of other countries. So anyway, somebody's got to make the joints and then get them approved and all this kind of thing. So there's a lot of profit in that. Again, in dentistry, making products, when dentistry dental manufacturers developed composite materials to bond the teeth and build up teeth that looked pretty good, it looked pretty natural, and they're able to build it back up again. That opened up a whole new world of cosmetic dentistry, which was really, really huge. So that's something that's, I'm of course, intimately familiar with. I'm certainly familiar with cosmetic dentistry and the products that equipment manufacturers make that opened up the whole field of cosmetic dentistry. And so, again, huge profit motive. When you want to find out some more about that particular area, again, check web-dds.org, my website. You can read about the development of adhesive dentistry and cosmetic dentistry and composite bonding and so forth. And whatever happened to amalgams. Anyway, another subject. Another part of the healthcare industry, big pharmaceutical companies. We are a society that when we get sick, we want to take a pill and make us better. We kind of got used to that idea, many, many decades ago when antibiotics were first developed. And, but we've also kind of come to think that, maybe just taking a pill is going to take care of it. And we might be more benefited by actually if we led our life a little differently, if we did something different as opposed to just taking a pill and trying to make ourselves feel healthy. To actually be healthy is a different thing. But look at what the pharmaceutical industry has done in terms of vaccines this last couple of years. That's impressive. So the capabilities of the pharmaceutical companies to solve things that aren't really solvable any other way is, fantastic. The dedication of the people that are in the pharmaceutical industry. Again, it's a profit-making industry, but on the other hand, when I was a chemist, and I worked as a chemist for a long time, lots of people working in pharmaceutical industry and making a lot of compounds that are tested to try to see if they could actually cure specific diseases, and that is becoming more and more scientifically based, and more driven by a finer and finer understanding of what's involved with those diseases and what chemicals have fit in certain places to take care of that. So it's really impressive scientifically, and again, the development of these vaccines was just, astronomically fast this year. On the other hand, should we be taking pills, for everything? No, we should, look for a healthier lifestyle. I go back to Jack Kennedy, when he was president, and he started the whole thing about jogging. Okay, let's get out and actually move around and do something instead of sitting around on the couch watching, football all the time. So anyway, the pharmaceutical industry is a profit-making industry. Make no mistake about that. But it has shown some real dedication to solving some problems that could have potentially been really huge. I'm kind of alert to this right now. I just watched a movie a little earlier. I recommend it. It's an older movie. It's on Netflix. It's called Awakenings. And what an inspiration about a physician or a doctor or a scientist that really felt that with a newly developed drug, he could really help some people basically come back to life after they'd been, non-responsive for 30 years. Really impressive, and based on a true story. So, there are a lot of really dedicated people out there, scientists and physicians alike, that are, really trying to help us, navigate this complicated world. But, it's been no more complicated ever than it has been with this COVID pandemic. So, we can certainly look to the scientific community that's, provided, so much of a breathing room, basically. Okay, so all these companies that I just talked about, all these basic parts to the healthcare industry, hire lobbyists. That's the 9th basic group. Lobbyists basically influence the making of laws. I've referred to that basically within the legal community before. But, these companies want laws to be made to increase their profits. I mean, duh, that's what it's all about. If they didn't do everything they could to get laws passed that would benefit them, their investors would go nuts, okay? They would hold the board of directors responsible and so forth. So, everybody expects these companies to make a profit. I used to work for a huge oil company a long time ago. And at the end of every quarter, you've got to show that you're making money. Your value has to go up at the end of every quarter. And if it doesn't, you're going to be held accountable. The president and the whole board is going to be held accountable if they're not doing their job right. So, part of doing that job right is to hire lawyers as lobbyists to go to Washington and hang out and try to influence lawmakers to pass laws that benefit them. That doesn't necessarily benefit you, but it can, but not necessarily. But just realize that, the healthcare industry, as I've defined it, with these 8 groups, it's all about money. The wellness community is all about your care. But, the healthcare industry profits from your care It profits from your needs. It profits from your illness. We could think it profits from your health too, as long as they are, working towards, establishing a good base of health. So when it comes to lobbyists, I once worked with a lobbyist. He was hired by the largest dental employer in California to see if they could effect a law change, because that employer was hiring a lot of my students, because my students are international dentists, and they were able to get licensed in California, and this company was hiring a lot of them. And I knew I knew my students very well. I knew them as dentists and as people. And I wanted to give them, to help at least, give them a little bit more opportunity to be hired by this company. So there was an attempt made to write a law that didn't seem to go anywhere in the state legislature. And so, I started working with the lobbyist, and I basically said, okay, if we write it like this, that might go over. And it did, and it gave my students 5 more years of being able to get licensed in California as international dentists. Now, of course, I did that for 2 reasons. One is money. I made money teaching these international dentists, and these are my students, and they paid me to teach them. So realistically, of course, I did that for that reason in one case, but also, you won't believe when somebody comes from another country, immigrates from another country to try to be able to achieve a practice of any kind of medical profession in this country. The sacrifices they have to go through, that they have to accept, are staggering. When I first had one of my students early on in my career teaching, international dentist, telling me that he was driving a taxi, trying to make a living while he was waiting to get licensed. He was making a living driving a taxi in the airport, and he would study for his exams in his taxi while he was waiting in line to pick up a fare. Okay. And I don't know if I'd ever run into anybody that's quite that dedicated, that devoted, and had taken such a big risk in their lives to achieve their dream. And I wanted to support that dream. So in any event, the healthcare industry is very complex, quite varied, involves many different people. Each of those people, even though they work for profit-making organizations, each of those people is a person with certain personal qualities, and the qualities they have determines whether they compromise the care you get, or whether they actually can, effect an improvement and an elaboration of the care, and offer things to you to help you survive, help you thrive, that were never available before. So it's all part of the same kind of thing. All right, so the next video we'll talk about the regulatory community, and that's basically the government, and they're wanting to control the healthcare system.